You probably know you shouldn't sleep in your contacts. Most people do. But what if I told you that's not the mistake eye doctors worry about most? Because every day, millions of contact lens wearers do things that seem completely harmless. Taking a quick shower, topping off yesterday's solution, stretching a month's lens for a few extra weeks, even putting contacts in after touching a gas pump or shopping cart. The problem is that these habits don't usually cause immediate pain. They don't trigger some dramatic warning sign that tells you to stop. Instead, they quietly increase your risk of irritation, dry eye, infections, corneal damage, and in some cases, permanent vision loss. And that's important because contact lens problems are often cumulative. They build slowly over time until one day your eyes finally let you know something is wrong. Hi, I'm Dr. Ayesha and welcome to my YouTube channel. In this video, I'll show you which everyday contact lens habits put your eyes at the highest risk for infection and vision problems. Why some of the most common contact lens myths are completely wrong, and the simple changes you can make starting today to keep your eyes healthier, more comfortable, and safer for the long term. But before we get into this list, I think it's important to understand one thing that most contact lens wearers never think about. Contact lenses are not accessories. They're medical devices. If I held up an inhaler, a knee brace, or a prescription medication, nobody would treat those casually. People understand they're medical tools that need to be used correctly. But contact lenses are different somehow. Because they're comfortable, convenient, and part of your everyday routine, it's easy to forget that they are sitting directly on one of the most delicate tissues in your body. The problem isn't usually one huge mistake. It's becoming comfortable enough to start taking shortcuts. And almost every dangerous contact lens habit we're about to talk about starts with that exact mindset. So let's start with one that almost every contact lens wearer has done at least once. Number one, sleeping in your contacts. And before you say, I already know this one, stick with me for a second, because most people dramatically underestimate why this is such a big deal. Here's a scenario. You've had a long day, you get home from work, you sit down on the couch, next thing you know, you wake up 2 a.m. and your contacts are still in your eyes. Most contact lens wearers have done this at least once. The reason people keep doing it is because they usually get away with it. Your eyes feel a little dry, maybe a little irritated, but by lunchtime, everything seems normal again. So your brain starts to think, maybe it's not that big of a deal. But that's the dangerous part. Contact lenses already reduce the amount of oxygen reaching your cornea. When you sleep in them, oxygen availability drops even further. So now you've got less oxygen, reduced tear exchange, and a warm environment where bacteria can thrive. That's when the risk of infection starts to increase. And here's what I want you to remember. The fact that you've slept in your contacts before and nothing happened does not mean it's safe. It just means nothing happened that time. So if you're someone who regularly naps in your contacts, even if it's just 20 minutes, this is one of the easiest habits you can change to lower your risk of complications. Number two, wearing your contacts longer than you're supposed to. This one is incredibly common. Maybe the lenses still feel comfortable. Maybe you forgot to order a new box. Maybe you're trying to save a little money. And on the surface, it seems reasonable. If the lenses still feel fine, what's the harm in wearing it a little longer? The problem is that contact lenses don't suddenly become unsafe on day 31. It's a gradual process. Every day you wear a lens, proteins, oils, debris, and microorganisms accumulate on the surface. The lens material also begins to change. It may not hold moisture as well. It may not transmit oxygen as efficiently, and it may not stay as clean as it did when it was brand new. Think about it like a toothbrush. You can keep it clean, but eventually it needs to be replaced. Contact lenses work the same way, and this mistake isn't limited to monthly lenses. Many people rewear daily disposables, but daily disposables are designed to be worn once and discarded. But because your eyes don't hurt, doesn't mean your eyes are healthy. Many contact lens complications start long before you notice symptoms. Number 3, letting water come in contact with your lenses. This is one of those mistakes that surprises people. After all, water is clean, right? The problem is that clean and sterile are not the same thing. Maybe you shower in your contact lenses. Maybe you swim with them. Maybe you spend time in a lake or hot tub. Or maybe you rinse the lens with tap water because you ran out of a solution. Water can contain microorganisms that become much more dangerous when they're trapped between a contact lens and the surface of your eye. Think about what a contact lens does. It's sitting directly on your cornea, right? So if a microorganism attaches to the lens surface, the lens can essentially hold it against your eye for hours. That's why eye doctors have a simple rule. Water and contact lenses should never mix. Not pool water, not lake water, not hot tub water, and not tap water. Number 4, putting your contacts in with dirty hands. And before you think, I always wash my hands, let me ask you this. Have you ever been in a hurry? Maybe you're running late for work. Maybe you're at the gym. Maybe you are in an airport bathroom trying to put your contacts back in. You wash your hands quickly, or maybe you skip it entirely because your hands don't look dirty. That's usually where the problem starts. After filling up your gas, you might check a text message, then pull open a door, maybe pick up a coffee. Before long, your hands have touched several different surfaces without you giving it a second thought. Then you're handling a contact lens that's about to sit directly on your eye for next 12 hours. Anything on your fingertips can potentially end up on the lens, and anything on the lens can potentially end up trapped against the surface of your eye. That's why proper hand hygiene isn't just a suggestion. It's one of the simplest and most effective ways to reduce your risk of irritation and infection. Number 5, topping off old solution and neglecting your lens care. You take your lenses out at night, there's still a little solution left in the case. So instead of dumping it out, you add fresh solution on top. It seems harmless. Why waste perfectly good solution? The problem is that contact lens solutions are designed to clean and disinfect at specific concentrations. When you leave old solution sitting in that case and continually add new solution on top, you're reducing the effectiveness of that cleaning process. You're essentially trying to wash something in yesterday's dirty water. And while we're talking about the lens case, let's talk about the forgotten piece of contact lens care. The case itself. A lot of people replace their lenses but keep the same case for months or even years. Over time, bacteria and biofilm can accumulate inside it. So empty old solution daily. Let the case air dry. Clean it properly and replace it regularly. Number 6, ignoring warning signs. This is probably the most dangerous mistake on the entire list. Not because it causes a problem, but because it allows a small problem to become a much bigger one. The contact lens wearer notices the eye looks a little red. Their vision isn't quite as sharp as usual, or perhaps the eye feels irritated, watery, or unusually sensitive to light. And instead of doing something about it, they tell themselves, it'll probably go away. I'll just need more sleep. My contacts are probably a little dry. So they put the lenses right back in and go about their day. Some of the most common warning signs include redness that does not improve, blurry vision, light sensitivity, excessive tearing, eye pain, or the feeling that something is stuck in your eye. None of these symptoms automatically mean you have a serious infection, but they do mean your eye deserves attention. If something feels unusual, take the contact lenses out. Don't try to push through it. Don't put in a fresh lens and hope for the best. If symptoms persist, contact your eye doctor as soon as possible. Let's finish with a few rapid-fire myths. Myth number 1, my eyes don't hurt. Everything is fine. Not necessarily. Many contact lens complications develop before pain ever shows up. Myth number 2, it's okay to sleep in my contacts once in a while. Every time you sleep in contact lenses, you're increasing the risk. Myth number 3, tap water is clean enough to rinse my contacts. Absolutely not. Remember, clean and sterile are not the same thing. Myth number 4, I can wear my friend's colored contact lenses. No, colored contact lenses are still medical devices. They're not one size fits all. A poorly fitting lens can scratch the cornea and increase infection risk. And if there is one thing I hope you take away from this video, it's this. The healthiest contact lens habits isn't just cleaning your lenses. It's respecting them, following the replacement schedule your eye doctor gave you, using them exactly as prescribed, paying attention when your eyes are trying to tell you something, and making regular contact lens exams part of your routine.